Hi, I'm Eva, Adam's friend. Providing healthcare for citizens is very costly, and it is one of the most complicated problems facing governments in most countries around the world. How do classical liberals view the healthcare problem? Is a market-led or a state-led healthcare system better? At this point, we can only briefly focus on naming the general principles on which a classical liberal approach to healthcare should be based. First of all, it is important to recognize that healthcare is subject to economic scarcity, and that people simply die. This is a sad but unshakable fact. People are dying and they cannot all be saved. Healthcare, too, therefore, has not only a value but also an economic price. The argument is often made that health is not a commodity. It is true that health cannot be bought and is itself priceless, but healthcare is a service and has a price. Doctors and nurses have to live on something. Similarly, it costs something to develop and test new drugs, not to mention the cost of modern medical equipment, or simply the running costs of hospitals. How are these costs to be covered? Healthcare is also subject to economic scarcity, so you can't get something for nothing here either. There are people who are bothered by the idea of profiting from the suffering of others. But in healthcare, the potential business profit does not come from people's suffering, but rather by eliminating suffering. According to classical liberals, healthcare should not only contain a moment of solidarity, but should also be based on rational economic foundations. Intrinsic motivations must be set so that all parties involved perform well in their own interests. Patients should be interested in prevention and in maintaining their health. Doctors should be encouraged to educate themselves in order to treat patients as quickly and cost-effectively as possible. There should be competition between health insurers or medical establishments, pushing prices down and quality up. The state should mainly have a control function and set general rules, but it should not hinder private initiatives or block contractual freedom between the various parties. Classical liberals think that it is ultimately better and cheaper for patients to pay directly for simple illnesses without insurance. Solidarity and insurance should work for severe and chronic diagnoses such as cancer. From a classical liberal perspective, the private nature of hospitals is not a problem either. Only a loss-making and debt-ridden public hospital is a problem. Classical liberals are also in favor of turning health insurance into real insurance, which motivate patients to take more responsibility for their own health. Health is an area with great potential for bureaucratic inefficiencies and wrong incentives. Once profits and market prices are taken out of a health system, it will be wasteful and slide toward bankruptcy. Poorly remunerated and bureaucracy-ridden doctors will go abroad or worse, tell themselves that they will only work up to their salary. In summary, over-involvement of the state in health care and conversely, the crowding out of market elements lead to higher overall healthcare costs and shortages of some services. As these phenomena can affect all of us, it is in our interest to fight for a healthcare system built much more on market principles. See you again.
Bye.